Hello everybody, welcome to today's webinar, or should I say webinars. My name is Shayla Stammers, this is Law of a Journey. I'd like to begin by acknowledging the traditional owners of the land on which we meet today, the Wurundjeri people of the Kulin Nation. I'd like to acknowledge their elders past, present and emerging. So today we have a bit of a double whammy. We're going to be talking about two resources for LDATs. Or local drug action teams, as I should say. The first one is the Stigma Resource, and the second one that we're going to be talking about is the LGBTI resource. But we're breaking it up into two half-hour slots. So if you're joining us for one, that's totally fine. And if someone you know is joining for the second one, that's fine. We will do the introductions as normal. A little bit of housekeeping. We have a 30-second delay with Skype broadcast, so obviously you guys are 30 seconds behind us. We normally have a Q&A box within...
Which
yes.
We're having some technical difficulties getting the Q&A box to function as normal. So our workaround in this case is just to say if you have any questions at all, to please send them through to drug info. So that is...
It's drug info, all one word, all lowercase, at adf.org.au. We have that inbox right in front of us, so it can function in the same way as a Q&A box within broadcast. Hopefully you're all in front of your computers and can do this. And if you're, as a group, if the person who's logged in can put down any questions and you can ask as we go.
Yeah, or if you have any questions after the fact, you're also welcome to mail them through and we will get back to you.
So just repeating the email, it's druginfo@adf.org.au. So feel free to still interact with us. I'm sorry for the technical sort of difficulty, but we'll get through this. Okay, so let's get started. So the first topic is the Stigma Resource. So you can find this on the Community Hub site as per normal. If you hover over the plan sort of tab, you will see a drop-down menu come up, and one of the key options is LDAT resources, so click on that and if you scroll down you'll find like the evaluation resource, the ethics resource, stigma, LGBTI, all the things that are not toolkits are basically in that location. So check it out. So today we will be going over the language. We'll be talking about stigma basics, so what is it, why we talk about it, the different types of stigma that we're familiar with, the variations of stigma and the role of the media. We'll talk about impact and why it matters to LDATs. Okay, so...
Yeah, so this is a PDF that can be downloaded that was just a language guide developed that's really focused on using person-centered language. And that's a language that this resource adopts. So the thinking behind taking that person-centered approach is that it's the order of the words that we use, not just the words themselves, that create images and ideas in people's minds when they're hearing what we say or reading what we've written. So the idea is that you make person-focused language uses person first, so that you recognize that first and foremost, the individual in question, whether they're a person who uses drugs or any other, a person who's stigmatized for any other reason, before they're anything else, they are a human being. This is a really handy guide. Our team uses it all the time. There's some use of preferred terms, of not preferred terms, and then on the flip side, they give some really good contextual details about how sometimes language use has to be done in context, and people have different thoughts about what counts as stigmatizing and not stigmatizing, but this is the general guide that the language used in this resource was based on.
And obviously this is a live thing, so language changes all the time. It's not set. So terms that we may have used previously that were considered okay might change to be associated with stigma. So I think a really good example of that is the word misuse. In this guide it's listed as stigmatizing. So it's just, I think that sort of contextualizes how quickly things can change and that it's important to stay up to date. And as much as possible sort of be aware of when these resources are available so that you can kind of keep them on hand. I know that we do in our team, so...
Yeah, and it's really, it's listening to feedback of the people that are being affected by this.
Exactly.
And, you know, what they're saying about how they feel when people use these kinds of words to describe them. So I think it's really important to listen to that voice.
Yeah, and just ask people if you're talking with them directly, what term do you prefer? That always works. Okay.
So in terms of what stigma is, fundamentally, stigma is a mark of disgrace. It's something that sets a person or a group of people apart from the rest of society, and usually that stigmatized person is judged first and foremost on the stigmatized trait, not on anything else about them. And in that way, stigma can reduce a complex human being to a stereotype. So a lot of assumptions are made often about a stigmatized person, about who they are, how they came to be that person, decisions they've made in the past, decisions that they'll make in the future. Stigma is very reductionist and can be quite discriminatory.
Definitely. Sorry, do you want?
I can just gently turn to you every time I need to look over. So in terms of why we're talking about it, look, there are a lot of good reasons to discuss it, especially in the context of the local drug action team program. And one of those reasons is that even people in programs that have good intentions can still inadvertently stigmatize. And often we look at a specific American program called the Montana Meth Project that, although the people who developed it had the best intentions of preventing and reducing young people's use of crystal methamphetamine, the way in which this was done was often by portraying really extreme faces, for example, of people who purportedly were dependent on crystal methamphetamine, or really graphic advertisements with a lot of things like violence and aggression. So although the intentions were good, these were actually quite a stigmatizing campaign, and that it presented worst case scenarios as typical scenarios, in that it was really attempting to leverage fear and frankly disgust towards people who use drugs to prevent people from using drugs.
And I guess the thing that stuck with me with that campaign is the imagery. And I think everybody learns and takes these sort of things in differently, but what is really powerful is when you see a version of something, and I think that it's hard to unsee that, and so the damage is really pervasive, because you can paint a stereotype in someone's mind that they then associate and can't help but associate with a particular drug. And so it's quite, it can be quite damaging for a long period of time, because that person may need to work quite actively to unsee that and disassociate that drug from that kind of stereotype. So I think it's really important to not, I think what the research has shown is that doing that can be more harmful than beneficial.
Yeah, and we'll talk a little bit more about the impacts of stigma later on, but to give a quick example of that idea of good intentions can have adverse outcomes, is that people might look at that and say they are not dependent on something like crystal methamphetamine. So they might watch one of these really extreme graphic ads and say, oh, well, that's not me, so I'm fine. I don't need to self-reflect on my own drug use or my own behavioral patterns. And at the same time, you might take someone who maybe is dependent on a drug, who sees an ad like that and feels really shamed because they're being made the object of disgust and aversion, so they're that much less likely to reach out and ask for help, even if they might need it or want it. So that's one of the reasons. And because of that, we think that all local drug action team activities, through all of the stages in developing the activity, it merits a really critical evaluation of the language we're using and the approach that we're taking, with an eye to that, being mindful that even the best intentions can sometimes have unintended consequences. And we're also hoping that raising this as an issue and diving into what stigma is and the impacts that it has will maybe start to spark some new ideas about what we can do in Australian communities to help to reduce stigma.
Okay, so there are 3 primary types of stigma that we're all pretty familiar with once we start talking about it. So there's social stigma, which is more the interpersonal and societal stigma. So that's what people experience when they go about their daily lives. And that links back to, that imagery that we were talking about earlier. If somebody has an image of somebody who uses a particular drug, they will stigmatize based on that understanding, unless they're otherwise, learn or change. Structural stigma is related to laws, institutions, and policies. So it's more around the spaces in which people who use drugs may experience discrimination. So a good example of that is if somebody walks into a pharmacy, for example, to receive a methadone dose, they might feel stigmatized if the pharmacist makes them take it in front of 5 other customers instead of in a more private setting where they can sort of demonstrate that they've taken it. So that sort of systemic kind of stigma can happen, and structural stigma can happen in lots of different places in lots of different ways. It can be overt, it can be inadvertent. It's complicated.
It is a complicated topic.
It's all complicated. Self-stigma is basically internalized stereotypes and prejudice that people experience. So it's where we're all products of our own society. So I think even though somebody might be in a position where they're taking recreationally or they're taking something outside of the parameters of their script and they know that that is causing them some kind of harm, but they're or maybe not, maybe they're just choosing to do it, they might still feel shame and project the stereotypes that they've grown up around, which is prolific.
Yeah, and it can really be coming to believe the negative things that are said about you.
Exactly, yeah. So lots of different words can come into this that are derogatory, and that's where the language part becomes really important because it becomes internalized and self-talk. So they're the kind of 3 key types. If you have any questions, again, it's druginfo@adf.org.au. We'd love to hear from you. Sorry about the technical difficulty. So, Laura,
I know, I put this
this
slide in here because it is my future thesis that I'm going to write. The why, especially when it comes to people who use drugs, and we'll speak in a minute about how not all people who use drugs are stigmatized in the same way. It is such a complex topic that is embedded in global history, in racism, in social stress, in economic pressures, in political control. There are so many things that feed into, and stigma is, it can be a living thing. It changes over time. People are stigmatized, different people are stigmatized at different times for widely different traits, and this does and can change. So although it is well beyond the scope of the work that we're doing to explain this incredible historical complexity as to why stigma exists in the way that it does now, what we do know is that it's hurting people. It's causing real adverse health outcomes for the people who are being stigmatized. Stigma has been described as one of the social determinants of health. So I can't give a one-liner as to why it exists, but I can say that we really feel that it needs to change.
Yeah.
Thank you.
No worries. Thank you.
So in terms of variations on stigma, not all people who use drugs or experience an alcohol or other drug dependence are stigmatized in the same way. So there's differences in terms of the type of drug that is used. Research shows that people have very different feelings regarding stigma towards a person who uses cannabis versus a person who uses heroin, for example, or use of alcohol is not necessarily inherently stigmatized, but some of the behaviors associated with alcohol use, like public intoxication or alcohol-fueled violence, might be. The frequency of use also feeds into that as well. To use cannabis as an example again, someone who smokes cannabis a few times a year might be seen very differently as somebody who smokes cannabis daily, and that's really true of any drug. The method of use is another issue that comes up often. The research again shows that injecting drug use is considerably more stigmatized than smoking, snorting, or swallowing drugs, and that there is
drinking.
Yeah, or drinking is the other way you can do that. And there's a range of potential negative health outcomes for people who inject drugs. And experiencing multiple stigmas. University courses are taught about intersectionality, but I actually really like your Venn diagram explanation.
Let's use these sheets as an example. So I guess the way that it works, if
this one's written all over.
Oh, sorry. So let's say this is stigma related to gender, and this is stigma related to drug use.
And my hand can be stigma related to ethnic background?
So intersectionality is literally where those three different types of stigma overlap and layer, and then that person experiences stigma for many different reasons, and it compounds. So they can feel very isolated because it's really complex, and they might experience that layered stigma from one person, or they might experience different aspects of stigma for those different characteristics in different settings. So obviously it's very complicated, but it's important to remember that people are more than just the drugs that they use, and all of those factors can also contribute to stigma.
Yeah, and we all have these really rich, complex details about who we are as people. And as we were saying earlier, in terms of stigma changing over time, like the stigma in any specific context can include things like gender orientation, sexual orientation, ethnicity, experience within the justice system, as well as alcohol and other drugs, and disability, and a range of things that, you know, anything that a person could be stigmatized for is going to compound and interact with all of the other things.
Yeah, definitely. Okay, so role of the media is really important in this context. I guess I'll mention Mindframes. So it's an organisation that is focused on providing anti-stigma kind of work in the space of mental health and AOD in the media. It's a really useful tool. I think we mentioned it in the resource. So basically, media covers all kinds of different things, all kinds of different topics, and really shapes public discussion. I guess that's the key from this, is that the media, even if you know, it's a small story about something in a local paper, it can still have massive ripple effects. And it can do things like repeating negative labels, so it's those stereotypes, reinforcing them, presenting worst cases as typical, which is what Laura's already talked about with the Montana Meth project. So picking the worst possible situation that someone could be in, and presenting that and labeling it as that drug, and then people associate that kind of worst case scenario as the norm. And definitely associations with crime. So it's a little bit unavoidable in some ways, because if people are reporting, for example, on a drug bust, or where certain drugs have been, you know, taken off the streets, or however they label it, you know, there is that association with the criminal aspects of drug trafficking. So, you know, that's a difficult one, but I think it can be done in a sensitive way. So there's really, in this sort of work where we're talking about reducing stigma, there's really a potential to have, you know, more sensitive reporting that can have a beneficial impact, and also have more of a health focus rather than a criminal justice focus. So Mindframes really focuses on providing, so if everyone's familiar, like if you're doing a report, for example, if you're reading a report in a newspaper, and it's, for example, to do with suicide in some way, or some kind of, I don't know, violent act, they might have Lifeline at the bottom of the report. So it's small things like that that can really have an impact on the issue and the visibility of stigma in media.
And AOD Media Watch has some good media guidelines as well, and you know, they and Mindframes as well. It's also things like respecting that, you know, when you're talking about a person who uses drugs, you're talking about a person, and they have family and friends, and to really be mindful of how you are how you're depicting that individual. Yeah,
and I guess the stigma relating to the use of drugs by anyone can also affect. Do we talk about it?
Yeah, we do.
Okay, I will not go into that. I'm ahead of myself.
But yeah, that last point about that, you know, there is the potential for media coverage to be beneficial if it is done in that sensitive way. And, you know, also in our ideal scenario, really takes that health focus, treating drug use as a public health issue, not a criminal justice issue or a moral issue.
Yes, definitely. So the impact of stigma?
Yeah, so the impacts of stigma are unfortunately wide-ranging, and it can mean reducing a number of opportunities for employment, opportunities for housing, opportunities for healthcare, all kinds. And I mean, that can be because of interpersonal stigma, right? That social level of stigma, and it can also be structural stigma. It can impact the quality of medical treatment that a person receives. Some of the literature shows that when a person is believed to be a drug-seeking individual or is known to be a person who uses drugs, that sometimes their legitimate symptoms might be discounted, or they may be inaccurately attributed to their use of drugs, as opposed to the unrelated health condition that they may in fact be related to. So that can mean that someone's not receiving the same quality of medical care that another person is, just because they're a person who uses or has used drugs. There's all of those additional harms if you have a criminal record or if you've been imprisoned that can follow, in some cases, you for the rest of your life, and be an impact on housing opportunities and employment opportunities, and really compound those harms. And then there's also the reduction in help-seeking behavior, which has, you know, some to do with self-stigma, but it makes people less willing to reach out and ask for help. And it might make them ashamed to access treatment services. It might make them ashamed to access legitimate medications like pharmacotherapies like methadone. So there's a huge negative impact on people's health and well-being when they experience stigma.
Yeah, I guess I'll just re-emphasize that a lot of people have reported, and there's studies to show this, and user groups talk about this all the time. People will have a negative experience with a healthcare provider once or twice, and then they'll they won't disclose all the information that they might have about their drug use in a future clinical setting, and that might actually impact the kind of healthcare that they receive. So even if people do seek help in the future, they might experience stigma that affects how they interact. They might still seek help, but they might sort of limit and selectively disclose about their drug use, which can cause harm.
And even the anticipation of being stigmatized can cause people to behave differently than they otherwise would. Stressful,
if anything.
Absolutely.
Yeah. Okay. So just to continue with that, we touched on affiliate stigma.
Yeah, and that's the stigma that's when people are stigmatized by being associated with a stigmatized person, which could be their family or their friends. And the impact of that is going to be different for every family and for every family member. And we do make a note about how not everyone who uses drugs in a family is not all parents who use drugs there's not always an impact on their parenting, and it's really important. We go into more detail in the resource about that. I'm not going to derail this presentation by talking specifically about how people who use drugs can be excellent parents, but the impact of that is going to be really different depending on if it's the parents who are using drugs, the kids who are using drugs, if it's someone's sibling who is using drugs, and then all of those other impacts like how often, what type of drug, have there been legal repercussions. It does affect everyone differently, but stigma can have a huge impact on families.
And it can also, through drug info, we know that sometimes family members can be a really strong protecting factor for a person who's using drugs. So they might have a really excellent relationship with a sibling who's supporting them, but they might be alienated from another family member in their immediate group. So not only does it differ family to family, but it can also differ between people within a family. So it's really unique how it affects people.
Absolutely. And that response to losing a loved one, there's just no way to generalize that. If someone loses a loved one to an overdose, for example, they might just want to never speak about it again. But then other people become really vocal activists for things like harm minimization. So it really, there's no way to generalize. Except to say that it's certainly a difficult time for any family.
Okay, so why does it matter to LDATs? I think I'm going to take a wild guess and say that it's going to be pretty obvious to everybody. But just to go through it, I guess it challenges stereotypes and oversimplifications around people who use drugs. It allows us a space to critically appraise language and our approach. So going through this resource and sort of reading up some of the information and the resources that are available, I think that can be really useful. So even just the newer guidelines, I think, are really handy. An emphasis on person-first language, it sort of puts into perspective how specific word orders can have a significant impact. Specifically, it's relating to a respectful community consultation. So using person-first language and being aware of the ways in which stigma is complex and prolific within our society will inherently inform how you speak to people.
And also how it's worthwhile to consider how your team will respond if you find that during the process of your community consultation, members of your community are being very stigmatizing towards people who use drugs or towards their family or friends, and how that can be managed, and then maybe how you have that conversation about person-first language and respect and recognizing that people are people before they're anything else.
And that last point's really interesting because stigma can have, or fear of stigma can have an impact on surveys. So how people complete surveys can really be influenced by their experience.
Definitely worth considering.
Yeah.
When we're doing the ever so tricky survey writing, that people might be much less willing to disclose drug use or family or friend drug use because of that fear of stigma.
Okay, so that brings us to the end of the stigma presentation or webinar. I'd like to thank anybody who joined us just for this one. You don't obviously have to stick around for the second. Obviously, you don't have to be here for any of it. But yeah, thank you for attending. We're now going to move on to another webinar, which is about a different resource for working with LGBTI communities. So we'll move on to that, and thank you for joining us. Again, if you'd like to send through any questions or comments or share any kind of, stories relating to stigma, we'd love to hear from you.
Yeah, absolutely.
We've had some technical issues with our Q&A box within Microsoft today, so if you could send through your questions to druginfo@adf.org.au. Obviously, you're welcome to talk to your relationship manager as well about any of this, and we'll continue the conversation.
Yeah, and it is a great conversation to have, because it's something that a lot of people have experienced some kind of stigma, maybe completely unrelated to alcohol or other drug use, either they or their family or people that they know. So we find that it can be a really interesting and engaging conversation with our colleagues as well. And something that people can feel really passionately about, especially when they've known someone who's suffered due to being stigmatized.
Definitely.